very good evening to everyone present in this session. Yesterday we have finished a big remedy, big antipsychotic remedy, that is the Thuja occidentalis. The three lectures we have discussed regarding the... Hello. So we have discussed regarding the Thuja occidentalis in detail over there. And today we're going to learn one more, that is the Argentum Nitricum. This remedy is again a wonderful remedy to be understood properly, because this remedy has a many actions. It is very depicting, covering both the psychotic and syphilitic aspects as well as soric. So this remedy many times used as acute as well as chronic remedy. Both things, both actions are there with the Argentum Nitricum. It can be used in acute phases also. It can be used in chronic elements also. And that's why before going into the Allen's keynotes, we'll discuss few cases, in fact, two cases, which were wonderful, where I have utilized this remedy successfully. The first case was a case of just newly born baby who was there in our hospital. The baby was delivered by normal delivery, but when we saw, the baby's eyes were absolutely agglutinated. There was a lot of, it was looking like a pus, granular pus, which was coming out, and the baby was not able to open. We have tried to open the eyes, and whenever we tried to open that, there was a lot of irritation, and because of which the child cries a lot. It was typical yellowish mucopurulent. It was looking like a gonococcal conjunctivitis. And the child was getting irritated a lot. The lids were swollen, looking little bit red over there. And there was a history of tremendous leukorrhea with that lady during pregnancy also. So, as a clinical prescription, I have utilized the Argentum Nitricum 6, directly 1 drop in a mixed with a drop of water and directly put into the mouth of that infant. Daily 1 dose for 3 consecutive days. And after utilizing it for 3 consecutive days, the eyes becomes day by day the clear. On third day, it was absolutely normal. It is a very important remedy in chronic conjunctivitis. Generally, the psychotic conjunctivitis, this remedy has a wonderful action. And the patients who are suffering from chronic conjunctivitis rubs their eyes are red, the discharge is yellowish, agglutinated in the morning. This remedy does the work, and that's why I have utilized this remedy, and it worked so beautifully, because the ophthalmia neonatrum, that has been the word which is used in Allen's keynotes for this remedy, is really a remedy for such types of infants. So that was one case I want to share with you, and it has clinical significance. Second important case was again a case of a, of a child, again 10 years. That is not a small child, but around 15 years of age, who was in 10th standard, appearing for the exam. It was in the month of December last year. And this fellow was brought to me with diagnosed as a case of anxiety neurosis. He was treated by a psychiatrist, but after psychiatric treatment, he was getting depressed and dull and drowsy. And he was not liked to study because of that. And that's why these parents brought him to me. They told me the history. He was absolutely brilliant chap, used to work hard. But what has happened, I don't know. We don't know. That he started getting aversion to mental work. He disturbed a lot. He was always hasty and hurried in each and every activity. Whenever he used to walk, he used to walk very fast. Whenever he used to eat, he used to eat very fast. The mother told that, doctor, when we used to sit together for lunch or dinner, before we complete or make the complete dish, he used to finish the whatever is there and he used to finish his dinner or lunch. He's so hasty and hurried in his eating habits, walking habits. There was one important symptom. He used to say, since last 6 months, he used to get bored and bored. Because of studies or not because of studies, because of his age, nothing was known. But he was say using one sentence, I'm getting bored, I'm getting bored. And he used to do anything. He used to go out, then again he used to come, then he used to read something, then he used to watch the movie. But every time he was asking, what's the time? There was a problem of time passes too slowly with him. And their parents told us, if we used to go somewhere else, he used to be the first person in our house who used to wake very early in the morning. If we want to start at 7 o'clock, he used to wake up at 4 o'clock. He used to be ready at 5 o'clock, and then he used to wait. There is always anxiety when the time is said. That was another feature of this Argentum Nitricum. And he was brilliant, but has developed that problem and he got depressed. So they brought this fellow to me. Then I took the whole case. Characteristic feature was he used to crave sugar more. Doctor, he likes the sweets, that's good. But he used to eat more sugar. Every time he used to ask for sugar. That was another characteristic. And not only sugar in the food, every time he requires the salt also. That was another feature which was present with this patient. And I saw his prescription. He was taking the tranquilizers. I stopped those tranquilizers. I asked them to start with our remedy. And I have given here Argentum Nitricum 1 ml directly, 3 doses. Kept him on placebo and asked him to meet me after 15 days. When after 15 days he was returned, he was absolutely a different fellow again. Remedy worked beautifully. He came out of that depression. He was looking very fresh. First important thing he told me, doctor, since long time I was having the problem that I was not able to concentrate in my study. That's why I used to get the bored. I have started getting concentration in my studies since last 7 8 days. On the day one, you have given me the 3 doses. It next day I the same day I slept whole night very peacefully, and next day when I woke up, I was feeling so fresh. First time I have started feeling yes, I am normal. That was the thing which has happened with the Argentum Nitricum. So for you have to understand the Argentum Nitricum core, and Alan has mentioned few things which are very, very important. So we'll open the Allen's keynotes, understand the Argentum Nitricum from his own perspective, and then if needed, we'll read Argentum later on. We'll learn it from different books also. So Argentum Nitricum from Allen's keynotes. The silver nitrate, AgO3NO3. Acute or chronic diseases from unusual or long continued mental exertion. First sentence given in italics. Long continued mental exertion producing acute or chronic disorders. The causative element is very important. Long continued mental exertion. With this case of anxiety neurosis, long continued mental exertion of a study was there. And many times, many students require this remedy. So this is very important future, which is one must think. Dr. Rashi has asked, can mental exertion include depression? No, depression is different. Depression is despair state. Mental exertion means he has worked mentally. Here, intelligence comes or plays the role. The people who used to work more on laptops or computer and doing a brainy work, intellectual work, that causes exertion. The sentence which comes out in the evening, I'm exhausted too much. They are seated in one place only. But because of mental utilization of intellect, they get exhausted. So it is an intellectual exertion that causes the problem with this remedy. So acute or chronic diseases from unusual or long continued mental exertion. Always think of Argentum Nitricum on seeing withered. Withered means which are weak, not having the flesh on body. Dried up. So as if there is no fluid, they are dried up. The whole body looks dried up. Old looking. So appearance is old looking. They are not looking fresh. They are not looking absolutely healthy. They are looking absolutely withered. The sentence is very nicely utilized over there by Allen. Withered look, old looking look, or dried up look. There is another remedy he has compared with it is the sickle core. But in sickle core, he has used one word, scrawny. Thin scrawny. Scrawny म्हणजे हडकुळा, crush, doesn't have absolute no flesh on the body. That is a scrawny. The sickle core, most chilly remedy over there. But it doesn't want to be covered. That is sickle core. They also looks older. Emaciation progressing every year. The patient is day by day becoming emaciated. Most marked in lower extremities. Very important feature. Ammonium muriaticum, another remedy. Abrotanum, marasmus of lower extremities only. Abrotanum, another remedy. But in abrotanum, it is the protein energy malnutrition which you can get because there is assimilation of the food. The first sentence in Allen's keynotes regarding abrotanum is there, alternate diarrhea and constipation. Lyenteria, that is the word which he has used over there. That stool contains undigested food particles in abrotanum. So it is absolutely assimilation is the cause in case of abrotanum. Here the things are different. Here there is a higher metabolic rate. The patient is hasty hurried. Patient is active, so active that he never sits in one place. That restlessness is because there is a mental restlessness. When the time is set, the things are set, the person becomes restless and his metabolic rate is fast. That's why there is a loss of flesh over there. So emaciation progressing every year, most marked in the lower extremities like ammonium muriaticum, marasmus. Apprehension when ready for church or opera, diarrhea sets in. And that's what we have discussed while discussing the gelsemium. One of the important remedy for nervous diarrhea, along with Argentum nitricum, the gelsemium plays very vital role. Both remedies are very important for nervous diarrhea. Whenever they have to go anywhere, immediately the anticipatory anxiety which develops in both of them, and both of them suffers from the immediate diarrhea. The things are rather different. In case of gelsemium, the person becomes dull, dizzy, drowsy, along with thirstlessness. In Argentum nitricum, it is not so. So, on the basis of state, we can differentiate the remedy, even though the symptom is very similar in both of them. It's one and same, but everyone's state is different. The person is absolutely drowsy, dull, never wants to talk, even so torpor. Torpor is the condition where there is absolute weakness. That state which is there with the argentum, with the gelsemium. And thirstlessness is characteristic of the gelsemium. Time passes slowly. Underline it. It is already given in italics. Cannabis indica. But cannabis indica is a drug remedy. Because of in cannabis indica, because their thoughts runs in a fast manner. Very hasty, hurried thoughts are there. Plans many. Big, abundant feelings are there with drug remedies. That's why the cannabis indica becomes cannabis is having time passes too slowly. Here it is different. The person is getting bored because he is intellectually keen. Here the key is time. Time is very important. When the time is set, the person becomes absolutely mm, restless and he feels bored. Impulsive, wants to do things, hurry, must walk fast, is always hurry. And this is the thing. Impulsive, impulse to do anything, impulse to jump, impulse to run, impulse to do something bad. Such impulsiveness is very characteristic with the Argentum Nitricum. So whenever they are doing anything, there is always an impulse behind. So you can talk them, keep quiet. We can do it gradually. Torpid and torpor, one and same. So patience is not there with Argentum Nitricum. They are always an impatient personalities. So whatever they are doing it hastily. Because of which many times they can make the mistakes. This is the problem with Argentum Nitricum. So understand this core of Argentum. Argentum patient comes to you in an abrupt manner. He comes, doctor, can I come? Whenever he leaves your room, he goes so fast that he opens door fastly and suddenly that type of movements, impulsive movements, you can watch with the Argentum Nitricum. I had one patient who was a share broker and he used to be always like that. He used to come in my OPD, doctor, I am having severe burning stomach, acid peptic trouble. And he used to sit in the whole day. He was used to sit in front of computer because their work was that. Right from 9 a.m. to till the 6 o'clock in the evening. And because of which I felt it is Naxomika, but he was not Nax. When I observed, after Nax, he was getting palliated, but he was not getting cured. One day I observed his actions. Whenever he used to come very fast. Whenever he used to go, he used to sit and abruptly go. Then I decided, then I understood what is wrong with him. Then I asked all the details and I got whole case of Argentum Nitricum because I have not retrospectively considered that case at that time. It was very early in my practice when I have not developed that eye to what to be watched, and because of which common remedy I have prescribed Nux. Yes, he was happy with Nux, but not completely cured. After Argentum Nitricum, he settled, his movement settled. He become a big personality over here, and he becomes his impulsiveness disappears. So this is what the Argentum Nitricum is there. Time passes slowly, impulsive, wants to do things hurry, must walk fast, is always hurried, anxious, irritable, nervous. Three words. They are quite anxious. Before doing anything, there is a tremendous anxiety. Anticipatory anxiety is more marked with the Argentum Nitricum, and that's why anxiety when time is set, that's very important feature. If their train is at 7 o'clock, they will reach at the railway station at 5 o'clock. Anxiety when time is set, that is the problem with Argentum Nitricum. They are always like that. They never get the whole night sleep. They used to wake up many times at night. This is the picture which you can get with the Argentum Nitricum. They talk to you, doctor, I could not get sleep, proper sleep whenever I have to go anytime, anywhere. I used to wake, I used to see the watch and how much time is there. And I never get good sleep before going anywhere. They are quite irritable. Irritability is more marked because they are getting bored more commonly. And lastly, the nervous. Nervous here, it is on the tip of their nerves. Activity, sensitivity, reactivity. All those things are very much marked with this. Aurum and Lilium tea, two remedies are mentioned over there. Very important remedy. But aurum, it is more related with the depression. Lilium tick, there is one important feature which you can get or which is shared with the platina also. That religiousness alternate with sexuality in Lilium tick as well as in platina. Both remedies are very, very sensitive remedies. So see the mentality of the Argentum Nitricum. If you are able to catch that core, then you will be going to get the Argentum very easily in your practice. Headache. Headache is congestive, means increased blood supply to the head, congestive, with fullness and heaviness. The patient says, Doctor, I'm getting very much heaviness in the head, with sense of expansion, as if head is getting expanded. Headache is habitual gastric. It is related with the gastric complaints. It is related with the constipation. It is related with the acid peptic trouble. So habitual gastric headache, habitual getting up and on. Headache of literary mean. Literary mean means who used to do a literary work, more mental work, not at all physical. Their headache is characteristic of this Argentum Nitricum. Headache from dancing, see, very important. Headache after dancing, that is very typical with the Argentum Nitricum. Headache, hemicrania, one-sided headache, like a migraine. One-sided hemicrania. Headache is pressive, screwing in the frontal eminence or temple, screwing from frontal eminence or temple, screwing as if some nail was pushed. That's what we have discussed in last remedy, that is thuja occidentalis. Here it is screwing from the frontal eminence or from the temple. Headache ending in bilious vomiting. This is too important. Doctor, whenever I used to get the headache, I always had a vomiting. I get yellowish, absolute yellow vomit, and then I feel better. This is the problem many of the patient tells you. And we never think about the Argentum Nitricum, but think about Argentum Nitricum with the people who are brainy workers, who are literary workers. Think of this remedy more commonly and they feel better with the Argentum Nitricum because it is so defecting remedy. So such types of migrants with literary people and who used to sit in one place, sedentary workers, this remedy do the wonder. Headache aggravated from any exhaustive mental labor. Any exhaustive mental labor. Mental labor, that is what he has mentioned. Mental labor is that to do a very hard study, mental labor. There are people from architect, they used to make a drawing whole night, sheets, mental labor. Because they used to think a lot. There is always a process of thought behind. The engineer used to work very hard at night for their studies, mental labor, and then the headache develops. So, because of mental exhaustion, when the headache develops, the Argentum Nitricum plays very vital role. Another modality which is there, arrested by pressure or tight bandaging, like apis or pulsatilla. So they keep hands pressing it hard. That is very important with Argentum Nitricum. Briny also feels better by that. Pulsatilla also feels better by that. So that is another feature which we have to think about. Apis is another remedy, but apis there is stinging pains more commonly. Apis there is thirstlessness. Apis there right-sidedness. Apis there is puffiness of the face. But here, Argentum Nitricum, you get the hastiness, hurriedness, anxiety, with which you can define or differentiate headache very commonly, not only on the headache symptoms, but rest of the things should match. Then it becomes quite easy to reach to the right remedy. So see, only we have discussed very few things of Argentum Nitricum now, but all are important. And keep it in your mind, the first sentence, it is a remedy for acute as well as chronic ailments caused because of chronic mental labor, mental exertion, long continued mental exertion. If you are able to catch these sentences properly, fit in your mind, then you can easily catch Argentum Nitricum personality. So any person who comes to you in your OPD walking very fast, impulsive, active, having some physical features like headache, hemicrania, craving for sugar, and the person where the time passes too slowly, such a remedy makes the wonder in such types of cases. Even in acute attack, it is a wonderful remedy. So we'll stop over here and we'll continue with it on Monday's lecture. I think this remedy will require another 2 sessions because it is a remedy one should understand it properly. Very important remedy in our day-to-day practice. Any queries there, we'll have a chat, otherwise we'll conclude. So
Sir, in case of exam fund, this Argentum Nitricum and Gelsemium is a good remedy for good remedy to prescribe, sir.
yeah, I could not get what you said.
Sir, in case of exam funk, that
Examination.
is Argentum Nitricum and Gelsemium is the good remedy for
Yes,
good remedy
definitely. Argentum nitricum is good. Gelsemium, if the state is of gelsemium, that means that if patient is drowsy, dull, dizzy, then gelsemium comes. Otherwise, gelsemium never comes. Argentum nitricum most common.
Yes.
Naxomic and Argentum nitricum difference in mental work and vomiting. Naxomica is very ambitious, very ambitious. There are a lot of cravings for stimulants in Naxomica, more marked, and their thought runs behind their ambition, because of which they runs very fast, hard, do a very big work, and because of night watching, working hard at night, they suffers from acid peptic trouble. That is the Naxomica. Argentum nitricum has a different story. What we'll do, tomorrow we'll learn the GIT aspect of this remedy, and then we'll differentiate. That will make things more clearer to you. Okay?
Hello. Thank you.
Hello.
Yes.
Hello.
विचार
सर, नक्स ओमिका ही अक्यूट रेमेडी मानल्या जाते. आपण क्रोनिक मध्ये देऊ शकतो का तिला क्रोनिक प्रॉब्लेम साठी?
नाही, क्रॉनिक प्रॉब्लेम्स मध्ये ती पॅलिएटिव्ह म्हणून वर्क करेल. इट विल नॉट क्युअर.
ओके.
It will work as a palliative. If you want a cure, this remedy will not do anything. You have to complement it.
कॉम्प्लिमेंटरी मेडिसिन द्यावं लागेल मग त्यामध्ये.
Yes, definitely. To cure, you will require the complementary.
Okay, sir. Thank you, sir.
Okay. Anything else? Ask your students to join this session because they will learn the practical hymns, which are very important. Dr. Yogesh sir, my suggestion is there. Please tell your students to join this session. They can learn.
Yes, sir. Definitely.
It's a free.
So can I give my students' numbers to join this group?
Yeah, sure. Ask them to send me their name on my number, and I will directly add them in the group.
Okay, sir. Sure.
Okay.
Yes, sir. It was nice session. Thank you.
Thank you and good night.